Oh yeah, this is a very interesting question. For a long time, the only alternative for patients with chronic myeloid malignancies who progressed to accelerated phases or more end-stage disease was obviously allogeneic stem cell transplantation. It's obvious that there is an interest now to explore now better the niche for new drugs for new patients, as we have new targeted drugs like momelotinib for some patients. The issue is whether you decide a particular patient should be a candidate for allogeneic stem cell transplantation or not, and at which point. And I think in that regard, there's a lot of effort that needs to be done in order to better risk stratify patients and enable doctors making more informed decisions about who and when should be a candidate for allogeneic stem cell transplantation. For example, how can these new drugs be used to improve and downgrade the risk of transplant for a particular patient, and therefore maximizing the likelihood of survival. The point is that we have new available drugs, we have a better opportunity to tailor these drugs to new patients, and we are not so sure about the fact that whether all patients should be delivered to an allogeneic stem cell transplantation when disease progresses, because we have strong evidence that mortality is high in particular subsets of patients. So the idea was to better identify those patients who develop who have poor survival, either overall survival or relapse-free survival, when they are treated with an allogeneic stem cell transplantation. And the idea here was to use artificial intelligence, actually machine learning tools, trained with the EBMT registry, which encompasses thousands of patients treated across many countries, mostly from Europe, and then deliver a tool which can be used to better identify high-risk patients. That is, those patients who have very poor survival after allogeneic stem cell transplantation. And our tool actually identifies 25-30% of patients who are high risk. They have a poor survival in terms of 1-2 year OS and relapse-free survival. And the results are quite compelling and probably will help clinicians deciding whether a patient should go for allogeneic stem cell transplantation or should be considered for novel medical therapies that we have at this moment. Oh yeah, so allogeneic stem cell transplantation for myelofibrosis. Well, that's the point of the paper that we've just published in Blood. I mean, it's the only curative therapy that we have at this moment. There is no other way to cure chronic myeloid diseases without an allogeneic stem cell transplantation at this moment. The problem is toxicity. And we know that 30% of patients, roughly 30% of patients with myelofibrosis who get a transplantation do perform very poorly. So we need to better risk stratify that, to take more informed decisions for the doctor, for the team of doctors treating these patients, and also for the patient, him or herself. And that means, using AI in a smart way in order to try to shed light on an unmet medical need. That said, it doesn't mean all the work is done. Now that we can better identify high-risk patients, now it's the time to study how can we improve their condition before allogeneic stem cell transplantation. For example, one question would be, can these new drugs deliver an improvement in overall tumor burden and performance status that can make that risk lower, and then the transplantation for some of those patients could still be an option. Well, that's something that could be addressed in the future, but we needed these tools before, and that's why the future is probably going to become more complex, because at the very end we are dealing with complex disorders with lots of clonal evolution and complex molecular biology underneath. So it is not going to be straightforward.